Good morning. Welcome again to a public health briefing that we're having weekly to keep everybody informed of what's going on. We're going to introduce the people as they speak so you'll know who's coming up next. So I'll start right off right away. The core city, Fargo City services are continuing to fully function. We are working for you every day around the clock, including essentials as garbage, recycling, public safety, drinking water, wastewater services, and mass transit. We continue to take the necessary steps to ensure services are delivered each day for our residents. Department and division heads are fully activated. We're following all the CDC recommendations to slow the spread, including frequent and deep cleaning of our public facilities across the city. Many of our employees are working from home. Some are taking on new roles in light of this COVID-19. Staff are actively responding to the public. Encourage everyone to check our website, fargond.gov/virtual. Utilize our social media for trusted source and accurate information. We are also actively working with our engineering team to prepare for potential flooding. Yesterday, the Red River reached a flood stage of 18 feet, and we have closed down the street on the north side of the city as a result. You will see some more road closures as we go through the weekend and go into next week, so make sure you check those before you head to work. So far, we have experienced an ideal melt and no new moisture. Let's hope that continues to hold. Just as organizations here are doing all they can to help residents, we need residents to help us. If we listen to the health experts, they are telling us to continue distancing and avoid unnecessary interactions. This is protection for everyone. The virus can spread too quickly to vulnerable people. The only way through this pandemic is to continue partnerships and collaborations. The federal government is working on a stimulus package which will provide substantial relief to those who may be laid off, furloughed, or work reduced hours. We continue to work closely with Governor Doug Burgum and Lieutenant Governor Brent Sanford in the state's response and potential future actions. Greg Tavine with Emerging Prairie is engaging in a robust social media campaign to reach younger people centered around Save Summer hashtag. We are working with Metro business leaders in many ways, including recent City Commission action allowing wine and beer sales to go curbside. We will continue to promote government and business partnerships. Tomorrow we will host a Metro COVID-19 Economic Roundtable at 1 p.m. in the Fargo City Chambers. We hope you tune in. We'll learn what the businesses are doing. With that, I'd like to introduce West Fargo Commissioner President Bernie Dardis to update the operations in West Fargo.
Good morning, and thank you, Mayor Mahoney. Before I start my comments this morning, due to a number of meetings that we've participated in, the three of us mayors, the commission president from Cass County, I want to say I am in awe of our healthcare industry, our healthcare professionals, our public health officials, both in Clay and Cass County. To be a part of those meetings is inspiring. To see the cooperation, to see the concern, and what they are trying to do to preserve the safety of our public. West Fargo continues to provide all of our services as well. Our facilities are, as far as City Hall, are closed, but we continue to work on all of our core services. The Public Works departments, all of those departments have been separated. So now each of them operates separately. There's no interaction between departments in an effort to help with social distancing. The police and fire departments are providing essential services while protecting their employees as well. Emergency management has been working and coordinating with all of the entities in the region to guide the decision-making of their responses. The municipal courts have been closed. We will not have municipal court until April 15th. We also have completely reworked the protocols for building inspections, and we have been working with the Home Builders Association through Bryce Johnson and a number of their board members. They've been wonderful to work with. We're very grateful for that, but we have a whole new protocol, and which requires calling ahead. Job sites must be cleared of other personnel before they will go in, again, to protect the safety of our employees. We know that the impact of everything that's being done for social distancing has a great effect on our businesses as well. This morning, the West Fargo City Commission had a special meeting. At that meeting, we approved that now All boards, all commissions, and the city commission can do virtual meetings. We had not had that in our city statutes. In addition, we have followed the lead of the city of Fargo and the city of Grand Forks, where we too in West Fargo now, as effective today, I signed it at 9 a.m. this morning, there will be allowed liquor sales for curbside and pickup. At the conclusion of my comments today, I want to, of all the things that we're dealing with, the safety of loved ones, the safety of our employees, all of those things that are so dear and important to us, with the manner of which the federal government is talking about assistance, I would love to remind the people of one thing. We are also in the process of doing the 2020 census. And I would ask all of you, while you're at home, while you're sheltering in place, to please consider making that a priority for your household. It is so very important to all of us. Thank you, Mayor Mahoney.
Thank you, Mayor Dardis. And we have Jonathan Judd, Mayor of Moorhead, and I think, Jonathan, you have some good news today about Minnesota. Something's happening.
Yes, I think it's always a great day to be a Minnesotan, for sure. We have a lot of things going on over there. Thank you, Mayor Mahoney. Thank you, Mayor Dardis.
I hear your counts are going down.
Our counts?
Your counts in the state, I think Jim talked about that today. Your counts in Minnesota have gone down overnight to another better number.
Yeah, so it went up 3 individuals within the state of Minnesota. Thank you for Commissioner Haney's update on that. I was not aware of that until this morning. But as far as the City of Moorhead update, the core functions, again, are fully functional. Police, fire protection, water, electricity, wastewater, and sanitation are functioning as normal. As announced previously, city buildings still remain closed to the public. Operations will continue with teleworking and flexible schedule policies implemented for employees to keep city business on track. The creativity of our city manager and her leadership team to make or continue to make us all Moorhead proud. And here are some of the ways that the city is adapting and protecting the public and our employees. Our first regular city council meeting in history was conducted with virtual meeting technology, including citizen participation. All 8 council members and the city manager were in remote locations outside City Hall. I feel like we went above and beyond what is required to ensure that the people's business was conducted with complete transparency. Emergency services are delivering the same level of protection. To limit potential COVID-19 exposures and spreads, they are evaluating service calls to determine those that may not need to intrude on social distancing, but taking a non-emergent style call by phone versus direct contact. Building inspections are now available with photo and video submissions, allowing construction to continue as possible throughout our city. Beginning Monday, Matt Bus will deliver Meals on Wheels for our seniors to address a volunteer shortage. Please watch our website for more information on how seniors can access Meals on Wheels. We expect increased demand with congregate meal sites and restaurants not open. And as a brief follow-up, I do want to give a shout out to the individuals who helped last night in Moorhead. We had cars, for those of you who are familiar geographically, from City Hall pretty much back up to the Taco John's on 8th Street. So there is a need. I do appreciate a couple of council members, Dahlquist and Carlson, and their families for coming out and helping out with that, because that line was extremely long. So kudos to those folks, and also to Pastor Michelle Weber for helping set that up, and hopefully we can continue that next month. While we adapt to COVID-19, we're also implementing the city's flood response plan. Mayor Mahoney briefly spoke on that. Fortunately, the weather forecasts are favorable. Know that flood preparation work is underway in both Moorhead and Fargo, and that COVID-19 will not impede the ability to address spring flooding. Fargo, my understanding, has closed Elm Street, and both cities are working to raise the bike bridges in our parks today. There will also be further protective measures implemented, but the projected river levels, as Mayor Mahoney spoke of, are manageable. So to let everyone know, we got this. We realize and empathize with the many families impacted by layoffs as businesses temporarily close to prevent the virus spread. The City of Moorhead and Moorhead Public Service, as of a press release last night, are now waiving late fees on utility bills until further notice. Also, briefly, I think Derek LaPointe will probably talk about this tomorrow at the Economic Roundtable, that there are grants for COVID-19 Minnesota healthcare organizations. One Minnesota-specific announcement we want to be sure gets attention today, and it is time-sensitive, that the state of Minnesota has made available $200 million funding for healthcare organizations to address COVID-19 impacts. The deadline, my understanding, is Wednesday, today at midnight. This funding is for all health-related organizations in Minnesota, including health systems, long-term care, ambulance services, pharmacies, and others. Please review the links on Moorhead's COVID-19 response page and submit an application if this could aid in your response to the pandemic. And finally, we've put other COVID-19 announcements and updates on our website, cityofmoorhead.com. We also further encourage the community to sign up for e-notifications to get updates by email as announcements are made. So again, thank you to the team that's assembled here today. Thank you for your work and your efforts. And for all of you in Moorhead that are individually and collectively coming together through this time, Moorhead proud, thank you again. And I will pass it over to Cass County Commissioner Chair, Mr. Chad Peterson.
Mayor Judd, thank you. Again, my name is Chad Peterson, Chairman of the Cass County Commission. Thank you everyone for watching, paying attention. First and foremost, prior to my election 8 years ago, I served as a volunteer on many committees within the city of Fargo, within Cass County. So I've been involved in county government for roughly 20 years. That's how I met Mayor Dardis 10 years ago, or 20 years ago now, on one of those committees. When you've served in government that long, be it as a volunteer or be it as an elected official, we often forget how little people know about what we do. We're ingrained in this. This is our passion. This is what we do. If you've never had a reason to go to the courthouse in Cass County, you've never gone to the courthouse in Cass County. And people don't know exactly what we do, and I'm going to touch on some of those things today. So first and foremost, what does county government do? We make sure seniors, families, and children are protected when the normal family protections won't function as properly as we'd like. We help you with assistance. We're the safety net when all else fails, ensuring families have at least the bare minimum of resources to put food on the table, pay utility bills, and ensure safety for the most vulnerable. That's what we do in county government. Some of the things we do, specifically core functions like law enforcement. That's our sheriff, our jail. We're the ones that keep you safe when you can't roam the neighborhood. That's our job to do those things. Specifically, more importantly, regarding this in terms of health, we do social services. Social services are adult protection services. They protect the most vulnerable seniors. Economic assistance, that's things like childcare, TANF, LIHEAP. We're the place you come to when you can't afford food. We're the place you come to when you need help with utilities. And those programs are still open. And my hope is that by the time you apply, get everything processed, this will all be over. But if it's not, you need to come and ask for help. North Dakotans and Minnesotans are a prideful bunch. I think all of us, and those that have moved here have learned this. We struggle asking for help. And when help is offered to us, we typically say no because of that North Dakota, Minnesota pride. Now is not the time to be prideful. Now is the time to show up and ask for help. It's okay. That's why you pay taxes. That's why these government organizations exist. We exist to help you and in your time of need. And again, hopefully by the time everything is done, you won't need it. But if you do, that's why we're here. We do family services like child protection, foster care, etc. as well. We also are home to the Veteran Service Organization, or VSO. If you are a veteran in Cass County, if you're a veteran anywhere in North Dakota, and I'm sure the same follows through my friends in Minnesota over in Clay, or any county, frankly, whether you're in Steele, Trail, doesn't matter what county, this is where you come if you're a veteran and need help. The VSO will instruct you and guide you to get you to the VA or whatever facilities are near you to make sure that you have all the services that you've earned through your service. What we've noticed in the last couple of weeks when we started up our automated entry system, where to get to the courthouse now, you can't just show up. You've got to have an appointment, be it by email or phone, ahead of time schedule. We've noticed the cases have been dropping. it's not that we have less people that need help, it's that we have less people coming. So I would be remiss in not saying thank you to those people that are doing what we're asking. They're conducting business via phone, they're conducting business via email, and you're saving yourself, you're saving our employees, and you're helping flatten the curve, if you will. So if you want to, please, to stay up to date on the latest information on the COVID-19, visit our Cass County website. It's casscountynd.gov. We also are on Twitter, Facebook, as the rest of us are, I'm sure, as well. One thing I'd also need to touch on today is our flooding. So I think we're safe in the urban areas. Yes, we may have some flooding. We may have a little bit of stuff like Mayor Judd mentioned, the Elm Street Road up by where I live is closed. Hopefully, that's about as bad as it's going to get. But our friends in the rural area will be impacted. So we'd like to encourage you to start flood preparations. If you need sandbags or have questions, again, check the casscountynd.gov website. If you need to call, our flood hotline is 241-8000. We're not going to be doing, as we did last year, the mass meetings. Obviously, we want to avoid less than 10, 15 people in a room. 10 is the number ideally. We realize sometimes there may be one or two more, like we have here today, but we're distanced, we're safe. So if you need help, call. Again, the number is 241-8000. We'll be doing our best to do weekly briefings online at that website, so as things progress, Jason Benson, our county engineer, sort of our head of operations, that's going to keep us all safe regarding our flooding issues, will be giving us updates. We have 115,000 bags ready to go. They'll be deployed as people need them. If you want to purchase them, they're in bundles, I believe, of 1,000, and they can be delivered. The way we'd like you to conduct flood operations is this. Stick within your family if you can. Obviously, you'll probably need more than one or two to help you if you have a large flood event, but the smaller that group can be, the better it is for everyone in the long run. With that, again, I'd like to thank everyone for their participation. Thank you for your patience. Please let you know that county government is there, city government is there, and whatever we can do to help you, we are there. Please call, text, email. We'll be around. Thank you much.
Thank you, Chad. Clay County Commission has been involved with a lot of our planning and doing things, and we've been kind of trying to honor the 10-person rule. And so we're pleased today to have Jim Haney, the Vice Chair of the Clay County Commission, with us to talk. And Kathy has kind of been his representation before this, but going forward, we easily can accommodate everybody who needs to be in the room. So Jim, we're happy to have you here, and we'll hear what Clay County is doing.
Thank you, Mr. Mayor. Across Minnesota, there was some good news in the last 24 hours. The number of diagnosed cases of COVID-19 was only 3, which represents 1% increase in the last 24 hours. Very positive. In Minnesota, there are currently 262 confirmed cases of COVID-19, and this includes 1 death, regrettably. 3 of these cases are from Clay County. All 3 of these individuals are recovering at home and are being monitored by the Minnesota Department of Health. 1 individual is in the age range of 18 to 24, and the other 2 individuals are in their 40s. Clay County Public Health and partners are working diligently to monitor and slow the spread of COVID-19. To slow the spread of this virus, all Clay County buildings are currently closed to the public, including the Law Enforcement Center, the courthouse, and the Family Service Center. Only citizens with a scheduled appointment are allowed into these buildings at this point in time. To protect the employees and their families, Clay County has also implemented a remote work policy and a flexible work schedule. In addition, Clay County Motor Vehicle Department has also adopted a new appointment process. Citizens will wait in their vehicles until called upon to enter the building. This procedure follows CDC guidance on social distancing. If you have questions, please contact the Clay County Motor Vehicle Department at 218-299-5080. We want to thank the public for keeping health a priority. We understand that change can be difficult, and we commend you for your resiliency. Thank you.
Thank you, Jim. Next, we're going to hear from the North Dakota Department of Health Regional Field Epidemiologist, Brenton Niesemeyer. And Brenton's been keeping up with the state and what's going on. Is going to have his remarks today.
Thank you, everyone, for having me here today. I'd just like to update everyone on North Dakota's numbers. As of this morning, we've had 39 cases in North Dakota, 3 of them in Cass County, and 8 of our cases have been hospitalized. So our thoughts are obviously with those that are in the hospital and those that are recovering at home for a speedy recovery. I was asked to touch on the what our process is in the epidemiological process of these case investigations. So we work closely with our health facilities, Sanford, Essentia, Altru, Trinity, across the strait, and they report these positive cases to us via ELR, or electronic lab reporting. We get those results, and then usually we have a contact at the clinic, whether it's an ICN, director of nursing, or someone that they can give us a little bit of background information on the case from the provider's notes. And then, if able, we're reaching out to that person within 24 hours to talk about where they've been when they were sick, where they traveled, where they, who they were around, to try to build that contact tracing, which is probably one of the most important things of stopping the spread, is talking to these people who were exposed to this positive case and let them know to watch for symptoms and to stay home. That's the big thing. We want these people to stay home and not go out in the community, not go to the grocery store. Hopefully they have alternative means in which to get the basic needs so that they can stay home. And if not, we're able to work with social services and public health in the communities to reach those needs. And then as we're reaching out to them, we're letting them know at the same time that if these contacts were to test positive, not just to show up at our health facilities, because we don't want them just walking in or showing up unannounced. We want them to know the phone numbers of the health facilities in the community that they're located so that they can call ahead, so that that they're prepared, whether or not it's sending them through a drive-through, bringing them in a back door, or if they have a separate room set aside for them in some of these smaller towns. So that's part of our job as the North Dakota Department of Health field epidemiologist. And, you know, as these cases increase, we're going to become busier, so we are in the process of training our local public health units and others to be able to do that contact tracing, and then we'll be able to have more people doing it, and with that, we hope that we can mitigate this spread even further. And then the last thing I was asked to talk about was travel versus community spread, and I kind of touched on that with our contact tracing and our case interviews. We do ask them that travel history, if they had traveled out of the country or domestically 14 days prior to becoming ill. And then we also ask them, and if they hadn't done that, then we kind of define it as community spread, where that means that they picked it up in the community. They may have picked it up if they had coffee with someone, 10 days ago, or if they went to the grocery store. And those ones are a little bit more difficult to pinpoint on exactly where they picked it up, but it's good to know whether or not it was travel or community, so that our response efforts can be based on that, on whether or not community spread is present. And I think that's it.
Thank you, Brendan. Our next speaker is Director of Fargo-Cass Public Health, Desi Fleming, and you've been busy as well.
We have been, thank you. I just wanted to talk a little bit this morning just about what we have been doing in this response so that everyone is aware. Fargo-Cass Public Health is part of the North Dakota State Health Department Pandemic Response Plan, so that's who we are functioning under. So we provide support to the state by providing that local guidance and response, as well as local coordination. So we do a lot with our messaging. We're part of the Joint Information Center at the North Dakota Department of Health, so we have daily meetings with them, and we try to push out consistent messaging. We also work a lot on our social media platforms to look for, identify any gaps, any needs, also look for misinformation and try to respond to that so we can clarify things. Send out those news releases as those come out from the state, and also if we need to do anything local. We have had to, like with some of the governor's orders, we've had to do some local clarifying as far as kind of what it means for certain entities, or had our environmental health folks look at things, and our city attorney just to get some further guidance, and then we push that guidance out. And then we've been developing a lot of resources. The North Dakota Department of Health and the CDC websites are great. Sometimes the information is a little cumbersome to weed through, so we try to maybe break that down a little bit and simplify it and create some resources that are helpful for people. We're involved in a lot of meetings, partner meetings, which the technology has been great so that we can do our social distancing and do these virtually. But these various meetings, our EPR staff is in meetings, I'm in meetings, just kind of really helps us with situational awareness, helps us to identify our community capacity, and then also our gaps and our needs. As Brenton mentioned, so I'm in contact with the disease control quite a bit, and he is my direct line. So I am fortunate to have him housed in our building, and so he and I are able to meet daily to kind of get situational awareness. He has been working to help train up our nurses so that they can help with contact tracing as cases would increase in our area. So that has been a very valuable partnership for me. Our EPR staff have been working furiously to fit test around the region with those first responders groups. We have, and that fit testing, for those of you who don't know, is the N95 masks, the respirator masks for those healthcare and first responder groups that have to actually go through a process to make sure your seal and your size is correct. So we have done about 17 different entities, and close to 900 people have been through the process. What we would ask for going forward is that the agencies that we have fit tested, if you can do your very, very best to keep that process up annually, so that in the event that this happens down the road, that we don't have to scramble and do everybody all at once, because it really has been a big task for our staff. We also can assist with accessing the state medical cash on the North Dakota side. So the medical cash is for long-term care, healthcare, group home type situations that, and I think they also opened that up for first responders during this pandemic. But if local supplies are depleted during a public health emergency, then they can access this state medical cash. So an example of this would be this week we set up a tent at the Gladys Ray shelter. We basically had that need because our shelter was at capacity and we didn't have a way to practice that social distancing within that environment. And so it wasn't to add people, it was to give the guests that we had space to spread out so that we could have a better environment in case we would have exposures there. So that has worked out very, very well, but those are examples of things that people could access. So if you have needs for that, you can contact our agency and we'll help you through that process. And then we've been doing a lot with the Everbridge system, which is our mass notification system. So our EPR staff has worked continuously to put in different lists of people, long-term care, different entities, local public health. So if we need to put out messaging, that we can do that in a really efficient manner. So we use this extensively during the Elam home fire, and that worked really well to notify staff, to notify families, and it was all done, it can be done all at once and a message goes out. So that is something that we've been working a lot on. And lastly, we've just been helping our city with planning, helping the county with planning, doing return to work screens for employees that have maybe traveled or have been sick, or exposure risks. We're kind of working on a new document for exposure risks, so we'll be putting that out as well. But and we're trying to capture our daily activities in the web EOC. And so with that, we're hoping that city and county leaders can kind of monitor that and maintain situational awareness so that you know kind of what our activities are, and then if you have questions from that, then you can reach out. So that's what we've been busy with. Thanks.
Well, we all thank you. Your team's been working hard. We got another team that's working hard in Clay County. Kathy McKay is the administrator of the Clay County Public Health.
Thank you, Mayor. Clay County Public Health, we have activated our incident command team. So it just means that we're meeting daily, Monday through Friday, and working through all of the mitigation strategies. We also have others that are part of that team, and that includes our city and our county emergency managers, as well as our social services department. So we're all working together. We're communicating with our partners and others in Clay County, and some of those groups where ongoing communication is our our emergency personnel, our faith-based communities, our homeless shelter, restaurant owners, food pantries, schools, and child care providers, just to help with information and assist in whatever we can do. We also work, of course, closely with our Minnesota Department of Health. They partner with us in these efforts. We know the virus, as Brenton mentioned, talking about the community spread. We know in Minnesota there is community spread, so some of the numbers that we see, we don't know all of the cases. The testing hasn't been, we have not tested everyone because it isn't feasible. So we know that the numbers are kind of what they are for those that are tested, but we know that there are more cases out there that people that are ill that have not been tested. Minnesota Department of Health does our contact tracing at this time. When they are overwhelmed, then they'll reach out to our local public health agency and have us assist with some of that. We want the public to know it's still vitally important to talk about slowing and spreading out the growth of cases so we don't burden our healthcare systems and they don't have a large impact. Some of that social distancing includes recommending people use those drive-through delivery or pickup options for food, groceries, and other necessary household supplies when they can, avoiding that unnecessary travel. And of course, we always message about the practicing good hygiene. We want to also note that dental offices nationwide are really postponing their elective procedures, and they are focusing on their emergent dental needs. So we're asking the public to be sure they call their dental providers if they have a dental need versus using the hospital emergency department for those dental situations. We also know that the blood banks still need donors. So we are asking people, if you are healthy and it's safe for you to donate, to notify your blood bank and see about donating. When we have this social distancing and people staying home, sometimes that really slows down and they do need the supply. So we really encourage people to do that. And lastly, we really want to thank our community in our whole metro area for their efforts in following some of these directions and trying to slow the spread of COVID. We know it's difficult and it's challenging times, and we understand that people are under stress and really experiencing changes in their normal routines. So some of the coping strategies, and there are many out there, but just to let people know to maintain that healthy lifestyle. So with their diet, exercise, sleep, staying in contact with family, friends, neighbors by emails, phone, or other virtual communication methods. We also recommend people participate in their online faith-based services as they can. We are partnering with our schools in Clay County to get some information out to families, for families and children on coping with stress. That information will be emailed with the schools providing that, and they're also placing that in the bag lunches that they're being distributed out to kids for those school systems. So we also encourage citizens, as you're looking at trusted information, you know, the good sources, as we've talked about before, the Center for Disease Control, the Minnesota Department of Health, North Dakota Department of Health, and also we have First Link. So there's resources through that First Link system. We recommend that you check that out. And you can also follow Clay County Public Health as a Facebook page for updates on COVID-19.
Thank you, Kathy. And I know I've gotten questions about the homeless and how we will handle the homeless if a crisis comes in that regard. And each one of the healthcare departments have an answer for that. The state does provide some plans for that. So those of you who are out there that are concerned about that population, we do have methods to handle that. Now we're going to get into the healthcare departments and or the healthcare providers in our community. And number one, as Bernie had talked about, we want to thank all the healthcare workers in the area that are working 24/7 right now to take care of us. And what we're very excited about is our teams have come up with capacity and are coming up with ways of managing this. We're going to start first with Dr. Rich Vetter. He's the Chief Medical Officer for Essentia Health. Welcome aboard.
Great. Thank you, Mayor Mahoney. And I'd also be remiss if I didn't take time to thank our local and public health officials, government officials, for their leadership in these challenging times and everything that you're doing to keep our community safe. I'd also like to do a shout out to our healthcare teams, our staff, and particularly their families who, through their support, allow those of us that work in healthcare to carry out our calling. And finally, just to echo also those of the community and the community response to this challenge has just been outstanding. You know, their ability to heed the warning that the public health officials have given and to practice those infection prevention measures that are going to make a difference in the long run. At Essentia Health, we've been trying to approach this from two different points of view. The first is a public health perspective, which really is meant to reduce the spread of this pandemic and to not overburden our healthcare systems. And then the second piece is to really prepare our hospitals, our facilities, to care for sick people if and when they get sick and need our care. We want to be available for them. So first, the public health measures. Just want to remind people again, and I know we've heard a lot about the infection prevention measures, but it's really that hand hygiene, wiping down hard surfaces, the social distancing that's become kind of our lexicon. And that really means 6 feet a distance between people when you're interacting and less than 10 people in an area at one time. Also like to remind people, stay home if you're sick. There's other ways to contact your healthcare providers, so we want you to do that. Our businesses, our healthcare facilities have done a great job in restricting visitors, and we appreciate visitors, patients, and their families for their understanding in that regard. That can be real challenging, but those visitor restrictions stay in place for the time being. We've also, about a week ago now, implemented restrictive elective procedures at our facility, mostly to keep our patients and our staff safe, but also to preserve those supplies if and when we might need those. We've been ramping up our technologies. We're encouraging patients to reach out to us for care either through our eVisit platform or virtual visits. We encourage people to use their MyHealth connection to get to their provider. And we want to make sure, though, that people also understand that if they are sick and do need care, to reach out to us and not, we don't want any unintended consequences from people not seeking care when they should be seeking care. From a preparedness perspective, we continue to prepare our facilities, our teams, our supplies for a potential surge of COVID-19 patients. We've implemented our incident command structure. We're monitoring our supplies closely on a day-to-day basis. We continue to work on in-house testing. We've been currently using the North Dakota Department of Health. Their response times and interaction have been just outstanding. We really appreciate the contact follow-up that they've been doing. So again, thank you for all that. The North Dakota Department of Health also continues, like most states, to continue to refine the guidance around screening and testing, and we're continuing to upgrade our systems to do that. At Essentia, we think we will have in-house testing within the next couple of weeks. We do have the platforms already. It's just getting the test kits that we can use to run those tests. So again, just want to remind people, we're prepared to care for patients who need us, both at this time as well as into the future. And with that, again, thank you, and I'll turn it over to...
Hey, Dr. Vetter, just getting one question. Your visitor restrictions are what? Can you have one visitor per patient, or what is it?
In general, it's 1 visitor per patient, depending on the patient needs. We do have some exception areas. For example, our neonatal intensive care unit or OB units, we will allow both parents to be there. And then we also have a compassionate need provision as well. So if there's something where the family, it's important based on that patient's diagnosis, we'll do those on a one.
So people can reach out and talk to you on an individual basis if that happens?
Yes.
Okay. Next person we have up is the Vice President and Medical Officer of Sanford Health, Dr. Doug Griffin. Welcome.
Yeah, thanks, Mayor Mahoney. And again, I would echo my thanks to the government officials. All have been great partners to work with, and we appreciate the conversations we've had and the support. And thank you for all your dedicated work. So we appreciate that. I just wanted to make a few comments about where we sit currently at Sanford. So we currently have no shortage of equipment or supplies. We have plenty of ventilators. We have plenty of PPE. We currently are able to stay 30 to 90 days ahead of our demand, realizing that changes on a day-to-day and minute-by-minute basis, and we're constantly monitoring and continue to work on conserving our supply, and that's over and above what reserves the state might have that would be delegated to us. We have more than enough beds. Today we have 18 beds totally dedicated to the care of patients that were either waiting to rule out what you would call a PUI or COVID positive, and today additionally we're opening up 34 additional beds, and we have plans to greatly expand that if we're ever needed to do that. Wanted to make comments about testing, which continues to be in the media a lot, and I think is critical to us getting an understanding of what's going on. So pleased to say that Sanford launched its own internal FDA-compliant testing late this past weekend. And we also have the capacity to still test through the Department of Health, and I would echo they have done a tremendous job. And private labs. Capability was really a part of a tremendous effort on our laboratory team to rapidly validate to get this launched. So that gives us the ability to deliver faster results. The test is actually being run in our Sioux Falls facility, but given our courier system and collection, we have a turnaround from time of collection to results of 24 to 48 hours. Currently, we have the ability to process 400 tests daily, with plans to double that capacity in the coming weeks. We have had a bit of backlog of tests at the Quest Diagnostic Laboratory, and that's starting to be reduced. At one point, we had more than 300 tests that we were waiting on from Quest, and of late this morning, we're down to just over 200 of those tests, and that backlog will continue to fall. I wanted to give a little bit about some of our operations. Over the past 2 weeks, like many other healthcare organizations, we've seen a decline in our patient volumes as patients either work with their clinicians or decide to reschedule their appointments. So our surgical volumes are down about 30%, and our clinic volumes are about 40%. Right now, our Sanford primary care, internal medicine, and children's clinics are only available by appointment only. We want people to call ahead, and same days of appointments are available. Our non-urgent or elective procedures and appointments, our process allows at this point in time for clinicians to have a shared decision-making with their departments and their patients to decide who needs to be rescheduled, who needs to be seen urgently. We really feel that the physicians are best equipped because they know their patients' need better than anyone else, and we're proud of how they've responded. The bottom line for our patients is they will continue to get the care they need and deserve at the time that's most appropriate for them. Wanted to comment a little bit on our expanding. There's been a lot of work done by ourselves and many other organizations to expand the electronic ability to receive care. So we're now offering e-visits specifically for COVID-19 care across the Dakotas and Minnesota. And it's a convenient online questionnaire that you can do from home to share your symptoms, and then a Sanford provider reviews that and gets back to them within 4 hours with a treatment plan, perhaps a prescription, or an instruction to be seen in person or receive testing. We're also rapidly expanding our telehealth and video visit capability to meet the needs of patients outside the clinic. In the coming days, we'll be offering more telehealth options for primary care in virtually all of our specialty areas. And we're encouraging our providers to use this options for all patients when medically appropriate. There'll remain times when we will need to bring patients in a safe manner to work with them. And then finally, I'd want to comment, what should people do if they think they have COVID? So if they are experiencing a fever or cough, or feel you may have been exposed, for the health and safety of our patients, we're encouraging them not to go to their regular clinic, but rather contact or call their primary care provider or our My Sanford nurse line at 1-800-821-5167 or locally 234-5000. They can also present to one of our urgent clinic locations as well to be seen. But by calling in, we can kind of help direct people that may be potentially ill with this to the safest place and protect those people that don't need to be exposed.
So your primary symptoms, which you think the patient should watch for, is fever and cough?
Fever, cough, shortness of breath. But if you had any question, even if you felt like you had an exposure and even had different symptoms, we'd like people to call.
And some people have mentioned loss of smell or taste. Does that have anything to do with the virus?
Yeah, there's been some, one of the things, as we see more patients with with the disease. Those physicians, Dr. Mahoney and Dr. Vetter, will know that we learn more about the disease in other alternative presentations or other symptoms they might have, such as the loss of
So
smell.
both of you are saying, don't run right into the physician, please call ahead and you'll make arrangements for them to be seen. So they can be seen.
Yes.
And you guys will decide who should be tested, and for both systems, you'll have more intensity to be able to test if they need to be tested. Is that correct? Yeah.
Correct.
Thank you.
Correct, yeah.
I didn't mean to interrupt.
Oh,
but-
no, I was about done. We too have placed visitor restrictions and continue to monitor that. And our primary care is, primary goal is to keep our patients safe, deliver them the care when they need, and to keep our staff and employees safe as they do it. So thank you for the opportunity.
Well, thank you, everybody. This has been an informative time, and we're really excited that Minnesota may start breaking a bit, and we sure hope North Dakota does the same, but we'll all be vigilant and do the things we need to do. And I think we're all relearning how to have meetings, right? It's hard for me to argue with Mayor Judd because he's normally not in the room, so it's really hard when they have these new types of things that go on. But we're learning. So thank you, everybody, for coming in today, and thank you, everybody who's working so hard on this process. Thank you.